So please use the Q&A function to jump on and ask questions for any one of our panelists. We also today, you may see we have John Whitworth. He's our live artist for this session. He's an accomplished book illustrator and live sketch artist. John will be sketching our conversation in real time, visually documenting important takeaways. His sketch will appear every 10 minutes on your screen for a little bit, and it will last about 30 seconds or so. And we're just gonna watch his progress on his sketch, and then we're gonna see his final sketch at the end of the session. So don't be alarmed about that. If that pops up on your screen, that is normal. We're gonna be monitoring his progress. All right. Everyone, just a reminder, you're in the Q&A hearing loss session. We're gonna get started. My name is Maddie Martin. I am the moderator for this session. I am an Alport patient myself and am post-transplant and have hearing loss as well. I'm 50% deaf in each ear, and I wear hearing aids myself. With us today, we have a number of different panelists and experts on hearing loss. Just a reminder that the full bios for these panelists are located under the agenda. But just a quick introduction, joining us today are Dr. Sarah Matson. She is an adult audiologist from San Diego, California. We have Dr. Zoe Boxer. She is a pediatric audiologist from Chicago, Illinois. Our special guest today is Zina Jawadi. She is a board member from the Hearing Loss Association of America from Los Angeles, California. And then we have our two patient panelists, Grant Bonebreak from San Diego, California, and we have Drew Taylor from Indianapolis, Indiana. All right, we're gonna start with some questions. All righty, so first question I'm going to give to, Dr. Matson. So Dr. Matson, is there any new technology in hearing devices that would make it worth it for me to consider investing in any new devices?
Good morning. Yes, I think that at the end of the day, if you think about your hearing aid, it just has the same components year after year. So it can be a little bit gray trying to figure out when is the right time to get a new hearing aid. So they all just have a microphone to collect sound, an amplifier, and a sound processor, and a speaker to deliver it, right? And they come in all shapes and sizes. So I think if your hearing aid is maybe 4, 5, 6 years old, the advancements that have been made really center around how fast they can process sound and how much better they can handle feedback. And for those reasons, the end result is really a more clear speech signal. It sounds more clear because they can just do a better job, and getting rid of the feedback means less distortion, and so the fidelity is better. So outside of that, lots of bells and whistles, either teeny tiny, making them invisible, or really good rechargeability, more durable, definitely can wirelessly connect to things like your iPhone or your Android phone, which just makes it easy and more fun to listen to music and phone conversations or things like the Zoom call. So there's definitely some cool bells and whistles, but at the heart of it is speech more clear. And I think it is now if your hearing aid is maybe 5 years old.
Thank you so much. That definitely is very helpful. All right. Here we go. Dr. Boxer, I'm going to jump over to you for this one. What kind of hearing aids do you recommend for elementary or middle school children, and why?
Sure. So I work with a lot of young patients. So I commonly fit a behind the ear device with all of the electronic components housed behind the ear. And that device itself is attached to a custom ear mold. A lot of those behind the ear hearing aids offer pediatric platforms within that manufacturer, which is really nice because it allows me to enable indicator lights, which is really helpful for family members if they want to know maybe when the battery is getting low, or if they're wondering if the device is on, which is really helpful for younger kids who aren't able to report that to their families. Also, these hearing aids themselves are really durable. So we're looking at children who are active, at recess or play sports, things like that. They're going to be more durable than a couple of other hearing aids that are on the market right now. They also offer really fun colors, which is nice. I like to kind of include that discussion with my pediatric patients and their families of offering in those fun colors to them. A lot of those behind the ear devices are also FM compatible. So for the classroom, they may be able to access the FM system, which is really important for children in the classroom, just because we know that speech and noise is challenging and those classroom environments can be really difficult. So it's important to pick a device that may offer that FM compatibility. Also, a lot of the new behind the ear models, they offer a rechargeable model, which is also nice. Previously, they were just battery operated. So now there's definitely options for rechargeability through rechargeable options. And just like Dr. Matson said, a lot of them are now Bluetooth compatible, even for the pediatric models. So connecting to Bluetooth so you can stream directly to Android or iPhone, things like that. So I typically would recommend a behind the ear model, but again, it depends on the developmental level and age of the child as well.
Thank you so much. I really appreciate that answer. Dr. Matson, I'm going to go back to you for a second. I am wondering how often, I have a question here, how often should I be getting my hearing tested if I have hearing loss? And then also to piggyback off of that, if I don't have hearing loss, but I have Alport syndrome, but there isn't yet any sign of hearing loss, how often should your hearing be tested for that as well?
So it's interesting. There's not actually a guideline for Alport patients regarding hearing loss. I combed this way and that way, and it's not in the guideline. But I would just say that if you don't feel like you have hearing loss, but you do have Alport, there is a risk for hearing loss. And I think a really good baseline hearing test showing maybe that there is no hearing loss would be fantastic to have, just a good comprehensive audiology test. And you have that as a baseline. And then I think if you're under 60 and you are not showing hearing loss, being aware that it could happen. And so just kind of knowing what the warning signs are, and then maybe getting it rechecked every 3 years or so. If you do have hearing loss, it's, in my opinion, a really good idea to get a hearing test at least once a year. It's just good to touch base with your audiologist. If you're wearing hearing devices, it's important to make sure your hearing devices are operating properly. And we have some really good scientific ways to make sure that they are, and also that your hearing aids are tuned to exactly what you need. And so an annual hearing test will help ensure that.
Maddie, can I also add something to that as well?
Absolutely, go ahead.
So I also recommend annual hearing tests for my kiddos with Alport syndrome, just especially in the elementary school age and middle school age, just because we know that age is really hearing loss may come on around that age. So I think if there is a diagnosis of Alport syndrome, I think annual monitoring is really good for these younger kiddos, just to kind of be on top of it. Definitely sooner than a year if family has any concerns. But I agree with that annual hearing test is really important.
Perfect. Thank you for clearing that up as far as pediatric patients go. Dr. Matson, I'm not sure, or Dr. Boxer, I'm not sure if either of you have experience with different types of Alport syndrome, because genetically there are different types and it differentiates. But I do have a question from Kim here that says that her son has a severe form of Alport syndrome, which is the nonsense mutation. How worried should I be for him completely losing his hearing as he gets older? Is there any data that differentiates between missense versus nonsense in terms of hearing loss?
I'm not familiar with the different, with that particular form of Alport and how that increases or decreases the risk for hearing loss. So I don't think I would be an expert in that question, but I would add that some data came out that was published, I think from Spain, that suggested, I think it was around 2015, that even with a worsening of the kidney function, that the hearing loss was sort of independent from that. And so we used to think, when I was in grad school many years ago, that that if the kidney was failing, that the hearing would be sort of failing with it in parallel. But then some studies have showed that maybe that's not the case. But certainly more studies are required to really understand it better, and especially since there's so many different forms and presentations of Alport.
That's really interesting that you mentioned it. I know in my personal case, I went through kidney failure in 2019, and I had a kidney transplant, and I had also heard about that data. And my audiologist, from what she understood, she did not have that knowledge yet. So she also thought that the kidney function and the hearing function kind of ran parallel. But my hearing loss was stable after my kidney function. It had not changed or worsened at all. So that's interesting that you mentioned that. All right. Let's see. Zena, I'm gonna ask you a question now. I know you, in your work with the Hearing Loss Association of America, I know that you have a lot of experience with advocacy. I do have a question from Nora here. She says she's in South Carolina. Insurance does not help cover hearing aids. Are there any resources for help with obtaining hearing aids?
Great question. And unfortunately, yes, hearing aids are not officially covered by insurance. We are working on that as an organization. For instance, we are working on getting Medicare to cover it. There was a recent law related to this, and we are also working on helping get over-the-counter hearing aids to become enforced. So there are some things that we are working on right now around in this area. In terms of getting hearing aids in the near future, there are actually several things to consider. One is that there are organizations that are able to provide some financial assistance with hearing aids depending on family income and things like that. Another thing to look into is that there are actually an increasing number of insurance companies that are covering hearing aids, even if it's not legally required yet. And so I would definitely do your research on that. So for instance, here in California, if you're on UC SHIP, which is the insurance company for UC, so the UC universities, that is, they actually do cover hearing aids for one ear for I think something like 80% of that hearing aid. So there are an increasing number of insurance companies that are covering at least one side. So unfortunately, it's not full, but it's better than none, I see it as. Another thing to look into is that there are some government programs that are actually trying to encourage people to go into work and get accommodations in school. So something to look into is see if the Department of Rehabilitation might be able to give some additional resources or guidance in whether you're working or if you're a student, maybe the Disability Service Office in the university might be able to assist. If in doubt, you can also look online and see if there are any specific state-specific programs as well.
That was a great answer. Thank you so much for that. And Zena, I'm actually going to jump off because I have another question similar. And that would be, I know you mentioned accommodations in the workplace or accommodations at school. What type of accommodations may be expected, or what type of accommodations could you, I guess, inquire about in the work environment or in a school environment?
Another great question. I think the answers are different, so I'll start with school and then I will jump on to the work first. So even in school, I definitely think the kind of accommodations you'll get are going to depend on what stage in your schooling you are. So for instance, if you are a younger child, you might have, and you're in a public school, for instance, you would apply for a Section 504/IEP. That's the Individualized Education Plan. And you would also work with your school to get the right accommodations. And so for different types of environments, you'd need different accommodations. But some example of accommodations would include getting captioning, getting a hearing assistive technology, sitting in the front row if there's an ideal seat, having that, encouraging the teacher to face the students. Unfortunately, that is a lot easier said than done, but it's something that you can definitely inform teachers, especially if they know they have someone with hearing loss. They tend to be more mindful of that. Another thing you can request right now in this day and age is to request clear face masks. Actually, my classmates right now, I'm in school right now, and my classmates and instructors wear a clear face mask when they talk with me. And this is something that is, while it's definitely challenging to get access to clear face masks, that it is feasible, and I would definitely encourage you to look into that as an option. Another thing to also consider are accommodations for exams. So extra time, private room, especially if you have a prelingual hearing loss, it's definitely a common accommodation. If you are in school, in college, one other thing to look into is to see if it's possible to get a note taker, which also can apply to undergrad, is to high school and elementary school. But note taker, having a microphone, really emphasizing the need for a good microphone here, and maybe even like a private dorm room. This is something that some institutions offer. Each school has their own unique accommodations, and so there may be some specific things to consider for the institution, but these are just some examples. One other thing that I personally find really helpful, even though it's not a common accommodation, is to get a computer sound amplifier. So there are some apps that are actually designed to help amplify the sound, especially if you have hearing loss, and there are some companies that do it. And I have to say, it has been one of the greatest investments I have gotten, because not everyone has great audio, and this lets you take full control over your own audio. So this is something I would definitely recommend exploring. Not an accommodation for school necessarily, but something that I also find helpful is to have automatic captions. So Zoom has automatic captions for education. The hope is that it will be launched full time in the fall. And there is something called Live Transcribe, which is owned by Google, and it's something that you can turn on Chrome. And I have to say, it is so incredible. I mean, it's not, of course, not a professional captioner, but I think that it's pretty accurate for an automatic captions. In terms of the workforce, I will say, I think it depends on the kind of work line of work that you do. So for instance, if you're in the medical field, getting a digital stethoscope, which is an amplified stethoscope, is one classic example. There may be other things like in the work, of course, if you're working a lot in large settings, you might request captioning, but again, like it really does depend on the size of the company, so on the kind of work that you do. So one thing I might recommend doing if you have questions about work accommodations is to explore and research and see if there's anyone who has information about accommodations or what it's like to have hearing loss in that specific role. I found a lot of very helpful information online by doing some specific research or asking people in that field. And I recognize that might be challenging to have, but support groups are a great way to do that and to find information.
Perfect. Thank you so much. I love how detailed you were with that explanation in the different, age levels, whether it be in school or in college or in an adult workforce. I did get a comment or a question from the Facebook support group that explained that this person's daughter is going off to colleges next year. They don't know where to start to figure things out. How do we understand what accommodations a college might have? How do we have access to those accommodations if she's accepted? I would definitely recommend, Zena had some great advice there. For me personally, when I was accepted into college, I contacted disability services. All universities have them. So I would definitely look up whatever college you're going to, look up on the website for disability services, contact them, set up a meeting, and thoroughly discuss whatever discuss the hearing loss approach. And disability services, they're great. They are really knowledgeable about this, and they handle it really professionally. And they already have a lot of different options as far as accommodations. And so it's a personalized thing, Zena mentioned a lot of them, like asking the professor to turn and face the board, or preferential seating, sitting in the front row. My hearing aids are Bluetooth, so mine hook up to my phone. A lot of professors don't like you using your phone in class, so I have an accommodation that I need to be able to use my phone to adjust my hearing aids if if needed. And it's really great because I really think that it's very important to advocate for yourself and have your children talk to their teachers or talk to their professors, starting from a young age, and be able to advocate for yourself. But it really helps to have somebody back you up, like a disability services, and they will send a letter to your professors saying, this is kind of, it's legitimate, and these are the accommodations. So I would definitely recommend doing that.
And Maddie, may I add one thing?
Yeah, of course.
So another thing that's really useful is usually disabled student services, or now they're calling it student access something. So, but yes, you're right. Every university, even your community college, they definitely have that available. But one thing that's really nice is that they also frequently have relationships with either a on-campus clinic, because that campus actually teaches audiology. Like in my local area, San Diego State, and UC San Diego teach audiology. And so they have sliding scale clinics, or all kinds of neat options to help the student, because, most students in college don't have a lot of extra funds. And so there's all kinds of interesting ways they work with community clinics to provide services that you need. So if you get hooked up with disabled student services and then you need something, then you're sort of not like just flapping around in the breeze trying to find your own way, but they actually have relationships with those clinics and those providers that could prove really beneficial. And then one more thing I wanted to add about the workplace accommodation is a lot of my patients require special accommodations for phone. So their job is maybe customer service oriented, and they need to take phone calls, and they're really struggling having a customer call in. For example, I have one patient, he's a bilateral cochlear implant recipient, and he's trying to answer the phone, but he can't always hear. And so we just got an accommodation for him so he can have a Bluetooth bilateral headset, so that the sound from the patient goes into both ears, and he can have a boom mic so he can still have his hands free to work. And the HR department, the human resources department at his work was very happy to accommodate him. So definitely look into whatever you need to be successful. And I would just say, don't be shy.
One other thing I'd add, the thing I want to mention is I would also recommend being really proactive with accommodations. I cannot emphasize that enough, especially even with contact and disability service offices. For instance, you can contact them before you've even applied. And definitely if you've been accepted and you have more than one offer, I would contact the disability service office, because unfortunately some are more informed and have more experience with hearing loss than others. And I'm saying this from talking with so many people in the universities. So I would definitely recommend doing that. And because that can also help inform the decision, and may even influence the decision about what institution you end up picking. Unfortunately, I wish that wasn't the case, but it definitely, and of course you can help advocate for your needs and make sure that you get the right resources in whatever school you go to. But it is very helpful to have a disability service office, for instance, that might already have all the relevant technologies that you need. So there are a variety of resources. So I would definitely do your research before committing to a university.
Thank you guys so much for your input. We're going to take a little segue and go on to a different topic here. I am going to ask Drew. Drew, what was your experience like? First of all, do you have hearing aids? What's your experience with your hearing loss? And then I'm really curious to know, I saw that you attended the Indiana School for the Deaf. So just kind of talk a little bit about, if you can, your experience with, public school and school kind of with the hearing, and then versus what was your experience like there at the Indiana School of the Deaf?
Yeah, so I got my hearing aids when I was about 6 or so, I believe. I have 2 hearing aids, one in each ear. And so I started out in public school. Well, technically I started in a private school when we found out I needed hearing aids. And the school didn't want to accommodate for my needs of getting an FM system, so we transferred to public school. And they already had some kids, or they were just happy to do it. So that's when I started using an FM system in the classroom, and it did help me understand teachers, and they also help you understand group settings with other students. You can also hear the classmates because you can pass it around. And then I was in public school from 4th until 10th grade. And then I switched to the deaf school for the last 2 because I felt that I wanted to I felt the deaf school could accommodate my needs a bit better. And at first it was really hard because I did not know ASL, and it is a full ASL school. So I had an interpreter, and I had to learn ASL as well as I could. And I had it for about a year or half a year or something, and then I switched off, and it was still a struggle, but I did feel that the school was able to accommodate needs better because it's a smaller school as well. It's not public school, so it didn't have as many kids. So teachers were able to work more one-on-one and make sure each student was really getting all of the help that they needed with the class and learning what they needed to.
Great. Thank you so much. I think your perspective is really, really interesting, having kind of been immersed in both communities. My next question is for Grant. Grant, I'd like to start off asking you again, kind of similar to Drew, what kind of hearing aids do you wear? And then I'm interested to know, what are the most frustrating situations that you've experienced with hearing aids, and how did you adapt to that, and how did you help explain or help your family and friends adapt to that change as well?
Yeah, so I'm wearing hearing aids since right before 6th grade, and I just graduated high school. So I've had a little bit of experience with them, and I wear Phonak Marvel hearing aids now, which connect, Bluetooth to my phone. And that's been super helpful, and I absolutely love that feature. But I'd say some of the hardest situations have been, any kind of indoor like sporting event that has an echo was always the first one. Now, I love basketball, I love volleyball, so I witnessed that and I experienced that one a lot. And the best way I explained it to my family was just imagining, like we used to watch National Geographic a lot when I was growing up. And I told them, just imagine like those animations they did for echolocation where the sounds would bounce off the walls and you would hear it multiple times. And that's how I tried explaining it. I tried letting my parents, my brother wear my hearing aids. That didn't go that well, but I tried whatever I could. And, after going to different events with me, my parents started to understand how long it was before I got uncomfortable. And from there, it went to, we went to large restaurants. We'd always try to have my back facing to the noise so I could change my settings. Because I actually have settings, thanks to Dr. Matson, that can help me zoom in on certain speakers or certain directions so that if I had my back to the rest of the restaurant, I could avoid that hearing, which was super, super helpful. Now, especially since the pandemic, masks, can't stand them. As helpful as they are, can't stand them. So that's another thing. But luckily, I've got close friends, got close family, and they all understand at this point. It's like, I'm doing my best here. I'll change the settings, I'll turn up the volume, whatever I can do, and they'll try to help me out as well. So it's really all about, communication and not being afraid to speak up if you're uncomfortable.
Grant, I think you made a great point. I think all of us that do use hearing aids, we can definitely relate to the loud noises or, big echoey rooms. Those are definitely tough. My next question, I'm going to redirect to Dr. Boxer. I have a question here that says, what age should we start testing our 3-year-old son who has Alports? And are there any practices that we should put in place to kind of protect their child's hearing before a hearing aid stage?
Sure. So I recommend, again, annual hearing tests after even the newborn hearing screening. Alport syndrome is never present, at birth. So after that past newborn hearing screening, I still recommend annual follow-up with diagnosis of Alport syndrome and no known hearing loss. So with your 3-year-old, I would recommend, getting a baseline hearing test and then monitoring annually. Also, the preschools usually have a good school hearing screening program that can kind of also flag and refer you on into a pediatric audiologist if needed. Inner ear health screening is usually performed at the schools, so starting around preschool age. So I would just, again, continue with preschool screenings and then kind of locating a pediatric audiologist sooner rather than later, just to kind of be on top of it and following up annually or sooner if there's any concerns. If there's any other risk factors in the patient's medical history, I might recommend sooner follow-up than that year. It just kind of depends patient by patient. But good question about the protecting your hearing. I think it's never too early to protect hearing. Everything is very loud these days. So I think buying, over the ear headphone, they have really great options for little ones now that are over the ears. I see them worn in restaurants here in Chicago at different events like festivals in the park. I think always being proactive and protecting hearing is the way to go, no matter the age, baby or adult. So I think it's never too early to protect your hearing.
Perfect. Thank you so much for that. Dr. Mattson, I have a question that I'm going to ask. I know Grant talked about loud noises, and he talked about the features on his hearing aids where he can reduce background noise or something if he's in a loud setting. I have a question here from Deb. What do you recommend for Alport patients who have issues with tinnitus, sensitivity to crowds or loud noises, and inability to hear clearly unless someone is, directly in front of you? Are there devices, treatment options that help with this, and not necessarily just volume?
Yeah, that's a big question. So I'll just take it little bit by little bit. So tinnitus is a symptom of hearing loss. And so if you have tinnitus and you have untreated hearing loss, peer-reviewed research shows that 70% of people with hearing loss, if they treat their hearing loss using hearing aids, or if your hearing has gotten so poor that you can no longer benefit from hearing aids and were to use a cochlear implant, but treating the hearing loss will reduce the tinnitus to a much less problematic level. And that's just simply because the brain is trying to hear, and the tinnitus is a symptom of that. And so definitely, consider looking into that. Also built into hearing aids now, if the tinnitus is persisting and it's really bothering you, there are some built-in sound therapies in almost all hearing aids now. And these sound therapies provide sort of a masking effect to kind of just reduce how annoying the tinnitus sound can be. And so I definitely talk to your audiologist about that and see if there is an option for that built into your hearing device. You can also consider masking by using maybe like a nice meditation type music from your phone if you have Bluetooth with your hearing aids, and you could stream that in and reduce your perception of your tinnitus if you're really trying to study or compose an email or concentrate on something for work, etc. Sensitivity to loud sound is caused, there's varying degrees of sensitivity to loud sound. So when we have hearing loss, we have what's called recruitment. So that means that our brain is trying to recruit the neural activity to get the ear to be more sensitive. And so what happens is we have an abnormal tolerance for loudness. So for me, I might hear something getting louder and louder and louder and louder and louder and louder, and then, oh, okay, it's too loud, because fortunately I still have normal hearing. But if you have abnormal hearing, especially the kind of hearing loss that Alport's cause, your loudness curve is different. So it gets louder and louder and louder, and all of a sudden just it's too loud. So you have this very narrow area where you need to have audibility, but it can get uncomfortable easily, is my point. And so it's important that your audiologist helps you with your hearing devices to make sure you have the proper output control so that your devices are not making loud sounds uncomfortable. There is an extreme version of this called hyperacusis. This is where you actually feel pain in your ear with even sometimes normal to soft sounds. This is a very complicated issue. So I would encourage you to seek out an audiologist that has experience in treating hyperacusis if that is the problem. Maddie, I feel like I missed the second part of this, something about clarity and noise or something. Can you remind me?
Yes. So there was the second part of the question talked about are there any device treatment options that help with, a clear inability to hear clearly instead of just volume?
Right. Okay. Yes. So most hearing devices now have a really good sound processor that is trying to always adapt the microphone to help you hear the signal you want to hear versus the noise you don't want to. But the reality is it's only good and quiet up to about moderate amounts of noise. So if you're at a wedding with a band and 100 guests, we all are going to struggle. So pulling yourself away from the noise is going to be the easiest way to catch up with an old friend. But certainly making sure that you have a program for noise, maybe where you have some directional microphones that help you have more of a focused listening. And nowadays, Grant's hearing aids, and probably yours too, Maddie, they, you can control them with your iPhone. So sometimes you can sort of implement a little bit more noise control or something like that. But certainly getting a lot of facial expressions and lip movements in the context of noise is going to help you fill in what's just getting blended into the noise.
Perfect. Thank you so much for that clarification and explanation. I do have a comment here. I want to move towards Grant or Drew. December said that they noticed that their daughter, after wearing their hearing aids all day at school, she's very fatigued when she gets home. Grant or Drew, could you talk about any of your experiences with hearing fatigue? Did it happen after you came home from school? That type of thing. Grant, do you want to go first?
Yeah, I can go. I definitely did experience that at first. It's a whole new sensation, especially if you've had hearing loss for a bit and your body's gotten used to that, and you no longer have you kind of kicked some sounds out and you kind of forgotten them. The fatigue can set in very heavily. Now it's really just comes down to rest at that point. I can't say there's any remedy that I know that immediately fixes that, and it is a process. But there's a lot of things that are positive about that, because the things you hear with your hearing aids are so important that the fatigue kind of becomes worth it. I wish I could say that it just goes away super fast, but there is kind of almost like a learning curve to this. Luckily I got mine during the summer, my hearing aids, so I had time before school to get used to them. But then even during school, I would try to go to the bathroom or something like that, take out my hearing aids for just a second, breathe, try to reset myself. Anything to give myself a quick break. Or, since I tried to communicate with my teachers as much as possible. I would just ask them if I could leave the classroom for a second, just anything I could do. For the most part, people will accept that, and they're pretty nice about that. As long as you're welcome to communicating and being open about it, that makes things a lot easier. But there is definitely, a learning curve for a little bit, just for getting used to the fatigue. There's not much you can do about that, unfortunately.
Absolutely. I definitely can relate. Drew, what was your experience with hearing fatigue, or just, the adjustment of once you got hearing aids? And also, how did your family and friends adapt to that change for you?
Yeah, so I got my hearing aids pretty young, and I did want to say one thing with the school hearing test thingy, because I forgot to mention it then, but that is actually how my family found out that I needed hearing aids, because I was so good at like reading lips and upholding conversations that my parents didn't even realize that I had an issue. So those do work, trust them. Anyway, but yeah, so when I was in like middle school and elementary, after I like just started getting hearing aids and stuff, as my dad said, I like only would wear one at a time, because it was like my rebellious, since I couldn't do a lot of like things to like control what I was like my childhood, because of Alports, getting diagnosed kind of young, and then eventually, going into kidney failure, transplant, and all that. So, but I would go to school with like one in or two, or one usually, and I would switch off. And then I'd come home and I would be pretty tired. I think it is a thing, but I don't think I experienced it for too long, but I was pretty young when I had it. So I don't exactly remember pretty well. And then I don't know, it kind of just made it so, like, with my family and stuff, it kind of just made it pretty clear. So I didn't really have a struggle. I mean, they obviously helped with like getting batteries and stuff, but I was the only one until my youngest sister, Karma, who also now has hearing aids as well. I was pretty much the only one. So as my family calls me, I'm the guinea pig. I've been the first one to go through all this. And so, but yeah, there was pretty fatigue and I got used to it, but it wasn't too bad for me unless I just didn't notice anything, but it could be different for each child.
Thank you. I really appreciate your input there. I definitely can relate to that as well. I just want to note that as our session is coming to a close here, any questions that don't get answered in the live chat, the foundation, Alport Syndrome Foundation, is making note of all of these questions, and we will be following up to get their questions answered. But if anybody wants, if anyone's question they prefer to ask anonymously, if we don't get back to you, you can send your question to info@alportsyndrome.org, and we will make sure to get it answered. All righty. Oh, let's see. All right. And Joy made a great comment here, saying that a lot of patients find support on the ASF support group Facebook page for these issues as well. So definitely, if you're looking for support, if you have any other follow-up questions, the support group page is a really great resource to go to not only get information, but to maybe get some validation and support as well. We are kind of coming to a close here, so I'm gonna just ask one last question here. This is definitely, sorry about that. Hold on one second. Just a follow-up question, Zena, really quick. Do the hearing loss, are those accommodations available through the American Disabilities Act?
So the Americans with Disability Act protects, the ADA protects people with hearing loss in the workplace. It's not necessarily the ones who actually implement the accommodations would be the company or wherever you work. So, but yes, like the law that protects that protects people with hearing loss would be the ADA. But as I mentioned, there are other resources like the Department of Rehabilitation, like what the company can actually do, and that in itself can be its own separate panel. So, but the long story short is yes.
Thank you very much. I'm going to turn things over to Lisa. This has been a really great panel. I want to thank all of our panelists for their great input and their advice. We will be trying, the foundation will be trying to follow up on all of these other unanswered questions, but thank you guys. I'm going to turn it over to Lisa now.
Thanks, everybody. I know that just that time flew by, and there's so many questions related to Alport syndrome hearing loss. One of the reasons why is it's also understudied. So, I just want to encourage everybody again to think about, if you're a patient out there, to participate in research with us by participating in the registry, and helping us document your experiences, because the only way Alport syndrome hearing loss can be studied is by getting patient data. So I really appreciate you participating in the registry. We announced yesterday our new registry. This is really important. We also invested in Alport Syndrome Foundation, really our own investment in hearing loss in a brand new way, and that is through an investigation through the Temporal Bone Registry at Harvard. And this is something patients can do as well, to think about being a donor at the end of your life. Ears cannot be studied, the inside of your ear cannot be studied until post-mortem. So an anatomical gift is also a way to help research. So you can find that information in our resources information in the app. I want to thank everybody, all these panelists, for giving up your time on a weekend to share your expertise. And we will make sure that we follow up on all of these questions. At the end of this session, please remember to refresh your app on your desktop or on your mobile device so that you can see all the new resources that we've put there over this past day. And including during this session, we added an evaluation for this meeting. We would really love to have your feedback on planning our next meeting by giving us feedback on this one. Thank you so much, everyone, for joining us. I think we might have to do another webinar, gang, because there's so much information to talk about. We couldn't get to everything. So we'll probably be inviting you back.